Have you ever received an urgent call claiming your routine blood work revealed dangerous liver problems requiring immediate treatment? Robert Martinez, a 75-year-old retired mechanic from Houston, Texas, who had been feeling tired lately, thought he was catching serious liver disease early when medical specialists called about alarming findings in his recent blood tests. Within 4 days, he had paid $16,800 for fake liver treatments that contained toxic substances. Robert's story reveals how medical scammers target seniors with fabricated test results, using their trust in laboratory findings and fear of organ failure as manipulation weapons. By the end of this video, you'll understand exactly how these fake medical laboratories operate and learn the warning signs that could protect elderly patients and their families. Stay until the end, because Robert's experience shows how fake liver treatments can cause actual organ damage while stealing money, making these among the most dangerous scams targeting vulnerable seniors with health concerns. The laboratory crisis call. It was a Monday morning in May when Robert's phone rang with a call that would exploit his trust in medical testing. He had just finished his morning coffee when his caller ID showed what appeared to be a medical laboratory number. "Mr. Martinez? This is Dr. Susan Chen from Advanced Laboratory Services. I'm calling about critical findings from your recent comprehensive metabolic panel that show severe liver dysfunction requiring immediate medical intervention." Robert felt immediate concern. He hadn't had recent blood work done, but Dr. Chen continued with impressive medical authority and laboratory terminology that seemed legitimate. "Mr. Martinez, your liver function tests show dangerously elevated ALT and AST levels at 340 and 380 respectively, indicating acute hepatic injury. Your bilirubin levels suggest progressive liver damage that could lead to organ failure without immediate treatment." The caller knew Robert's age, his work history, and even referenced his recent fatigue symptoms during medical appointments. This personal information made the laboratory findings seem credible and urgently concerning. "I need to stress how serious elevated liver enzymes are in patients your age. These levels indicate active liver cell death that requires emergency hepatoprotective therapy to prevent irreversible damage." Building liver fear. Dr. Chen continued using sophisticated laboratory terminology and liver function knowledge that Robert found both impressive and frightening. She described organ damage and treatment protocols with medical expertise that seemed authentic. "Your specific enzyme elevation pattern shows classic signs of toxic hepatitis with progressive fibrosis. The liver panel reveals inflammatory markers, suggesting rapid deterioration toward cirrhosis without immediate intervention." She explained that Robert's mechanical work background meant he had been exposed to chemicals that commonly cause liver damage. Robert had indeed worked with solvents and automotive fluids throughout his career. "Mechanics like yourself face unique liver risks from decades of chemical exposure. Your liver has been silently processing toxins for years, and now it's showing signs of decompensation that require aggressive treatment." Dr. Chen created urgency by explaining that Robert's age made liver recovery more difficult, and that immediate treatment was his only chance to prevent the organ failure that would require transplantation. "We need to begin emergency hepatoprotective therapy within 24 hours. This specialized treatment costs $16,800, but it's the only intervention that can reverse the liver damage we're detecting." Dr. Chen explained that Robert needed immediate liver detoxification therapy to prevent organ failure. The specialized protocol involved intensive treatments designed to eliminate toxins and restore liver function. "Emergency liver rescue therapy requires immediate payment because we must prepare personalized hepatoprotective compounds for your specific toxicity pattern. Standard insurance processing would delay treatment beyond the window when liver recovery remains possible." She provided Robert with specific liver treatment codes and hepatology authorization numbers that sounded official. Dr. Chen seemed to have detailed knowledge of liver protocols and spoke with authority about emergency liver procedures. Understand this is expensive and frightening, but consider the cost of liver failure versus the investment in organ preservation. This treatment could save your liver and prevent the transplantation that would otherwise be inevitable. Dr. Chen created additional pressure by explaining that emergency liver treatment was extremely limited, and Robert needed to secure therapy before other liver patients filled available treatment slots. Based on your enzyme levels, we've reserved emergency treatment specifically for your case. Liver damage progresses rapidly, and hepatoprotective intervention requires immediate commitment. The payment desperation. Robert felt overwhelmed by liver failure terror and the pressure to save his organ immediately. Dr. Chen had created such convincing laboratory urgency that questioning the treatment seemed like accepting certain organ death. He agreed to the liver therapy. Dr. Chen guided him through the payment process, explaining that the liver treatment facility required wire transfer to secure his emergency intervention slot and begin detoxification. Preparation. Emergency liver rescue protocols require immediate wire transfer to guarantee hepatoprotective compound availability, and treatment equipment reservation. This is standard procedure when organ preservation is time-critical. At the wire transfer location, Robert hesitated when asked about the payment purpose. Dr. Chen, still on the phone, coached him to explain it was for emergency liver treatment, which sounded medically urgent and legitimate. Robert sent $1,600, believing he was saving his liver from failure. Dr. Chen assured him that treatment would begin within 12 hours and provided pre-treatment instructions for liver preparation. You've made a liver-saving decision. This hepatoprotective therapy will eliminate the toxins destroying your liver and restore normal organ function. The dangerous liver treatment. The address Dr. Chen provided led Robert to a converted medical building that appeared legitimate but lacked proper liver treatment, equipment, and qualified hepatology professionals. The people claiming to be liver specialists were not licensed medical professionals. They administered oral medications and intravenous substances that they claimed were personalized liver detoxification compounds. The fake liver therapy involved unknown chemicals that caused severe nausea, abdominal pain, and symptoms worse than any liver problems Robert had actually experienced. When he expressed concern, the fake specialists claimed this meant toxins were being eliminated. These intense symptoms indicate the hepatoprotective compounds are mobilizing stored toxins from your liver tissue. Liver detoxification requires temporary discomfort, as decades of chemical exposure are reversed. After 3 days of fake treatment, Robert felt sicker than he had ever felt. His liver area was painful, his energy was depleted, and he was experiencing concerning digestive symptoms. The liver crisis. Robert's condition deteriorated significantly during the fake liver treatment. He was experiencing severe abdominal pain, jaundice-like symptoms, and signs of possible liver toxicity from the unknown substances. His daughter became alarmed by Robert's appearance and insisted on taking him to the emergency room. The hepatologist there was immediately concerned by Robert's symptoms and the story of unauthorized liver treatment. "Mr. Martinez, you've been given substances that are causing hepatic stress and possible toxicity. Whatever treatment you received was not legitimate liver therapy, and these chemicals may have actually harmed your liver function." The emergency team had to monitor Robert's liver enzymes and provide supportive care to prevent organ damage from the toxic substances administered during fake treatment. Your baseline liver function was completely normal before this treatment. You've been the victim of a sophisticated medical scam that has endangered the very organ they claim to protect. The laboratory, truth comprehensive. Liver evaluation revealed that Robert's liver function had been normal for his age before the fake therapy intervention. The laboratory results claimed by the scammers had been completely fabricated. The fake liver treatment had caused chemical-induced liver stress that required monitoring to ensure no permanent damage occurred. Robert's natural liver health had been compromised by the toxic substances. His real physician was outraged that criminals had exploited normal aging concerns to administer liver-damaging chemicals while claiming to provide organs protection. This is unconscionable. They used fabricated test results to poison your liver while stealing your money. Your liver was healthy before their intervention. The investigation medical fraud investigators explained that Robert had been targeted by a sophisticated operation that focused on fake laboratory results to manipulate seniors into paying for dangerous organ treatments. The investigation revealed that the same group had scammed dozens of seniors using similar fake liver scenarios. They had stolen over $800,000 while potentially causing organ damage through toxic fake therapies. Police discovered that the scammers used detailed senior health databases, fake laboratory credentials, and dangerous chemical substances designed to create believable liver treatment experiences while exploiting organ failure fears. Warning signs. Robert missed looking back. Robert identified several red flags he wished he had recognized. Unsolicited calls about blood test results he never authorized. Legitimate laboratories never call patients about critical findings without established medical relationships and proper physician communication. Channels. Immediate treatment demands with same-day payment requirements. Real liver treatment is coordinated through established medical facilities, with comprehensive evaluation and insurance verification procedures. Pressure to begin treatment without hepatology consultation. Legitimate liver specialists require extensive evaluation before starting organ treatment and encourage patients to seek second medical opinions. Wire transfer requirements for medical treatment. Established liver treatment centers process payments through normal medical billing and never require wire transfers for emergency interventions. The recovery process. While Robert never recovered his 16,800, his liver function gradually returned to normal as the toxic effects of the fake treatment subsided. His natural liver health was eventually restored through proper medical monitoring. Robert's experience led to increased awareness about laboratory result scams targeting seniors in his community. He began working with senior organizations to educate others about fake medical testing fraud. Most importantly, Robert learned to verify all unexpected laboratory communications through his established healthcare providers before taking action regarding test results or treatment recommendations. Final thoughts. Robert's story demonstrates that laboratory scams are uniquely manipulative because they exploit our trust in medical testing while potentially damaging the very organs they claim to protect. These criminals understand that seniors respect laboratory findings and will pay significant amounts for treatments promising organ preservation. The key lesson from Robert's experience is this: legitimate laboratory results are never communicated through unsolicited phone calls demanding immediate payment for treatment. Real blood work abnormalities are discussed through established medical channels with proper physician interpretation. If you receive calls about abnormal blood tests or emergency organ treatment, hang up and contact your established healthcare providers immediately. Never agree to organ therapy based solely on phone calls, regardless of how medically urgent the laboratory findings sound. Remember, protecting your organ health means working with qualified medical professionals through legitimate channels, not paying scammers who exploit laboratory fears to sell dangerous treatments. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.